Ms. Angelines to the podium.
Good evening, fellow classmates and families of the 2013 Health Science Technology class, and thank you for joining us on this memorable evening. At the beginning of our freshman year, many of us weren't aware of what we were capable of. But now, 4 years later, here we are, as either candidates or for a certification or already certified. I'm sure I can speak for us all on the uncertainty and fear we faced as we walked into Dr. De Leon's class that first day of freshman year, or the ambition that raced through our bodies when we learned about the body and how it works with Dr. Gonzalez. And who can forget the excitement we faced that we could hardly detain as we walked into the hospital on our first day of clinicals with Ms. Ramirez and Ms. Norman. Now, whether we faced our hardships and struggles with Dr. De Leon or with Mr. Ibarra, Ms. Chavez, and Mr. Basan, our hard work is about to pay off. Let us now begin with the purpose of our gathering, which is to recognize our accomplishments. Thank you. Can Alexandra Lada come up for the Pledge of Allegiance?
Sorry to do it back then. I'm in trouble. Okay. Let me get my, say, can you see by your dawn's early light what so proudly we hailed at the twilight's last gleam, whose broad stripes
Heavenly Father, thank you for allowing us to gather here tonight to recognize the 2013 Health Science Technology class. Thank you, Lord, for your guidance in fulfilling our goals, and thank you for our teachers and staff who help guide us to where we are now. I ask you to continue to guide each student and teacher so that we may follow the path you have laid out for us. In your name we humbly pray. Amen.
You may sit down. This time I'd like to call to the podium Ms. Anaia Garza.
Hello, everyone. Good evening, parents, staff, and health technology students. My name is Anaia Garza, and I will be introducing our HST instructors this evening. I will begin with Dr. G, Dr. Elvia Gonzalez. She received her master's degree in hospital administration and a doctoral degree as a medical doctor. She graduated from La Escuela Superior de Medicina as well as the School of Public Health in Mexico City. She spent 18 years at Memorial Hermann Hospital in Houston prior to coming to South Texas. She's been part of the San Benito High School District for 10 years and currently teaches principles of health science, medical terminology, and health science technology. We love you, Dr. G. Next, we have our famous Dr. Annabelle De Leon. Who has been with the MA students since freshman year and is just like a mom to all of us. We have something for you. You have been a great inspiration to all of us, and we thank you for everything you do. Okay. She received a medical degree from la Universidad Autónoma de Tamaulipas, Facultad de Medicina. And she also received her Associates of Applied Science from Texas State Technical College. Dr. De Leon is also certified as a surgical technologist by the National Board of Surgical Technology and Surgical Assisting. She's been part of San Benito High School for 4 years and teaches several classes. These include Principles of Health Science, Medical Terminology, Health Science, and Practicum in Health Science too. That's a lot. In which we focus on medical office assisting and medical assisting. Thank you, Dr. Lee. Our next instructor is Mr. Jaime Ibarra. Mr. Ibarra received his medical degree in Allied Health and Emergency Medical Services at the University of Texas at Brownsville. Ooh, UTD. He has been part of San Benito School District for the last 5 years as a primary District for the past 4 years and is an instructor for the EMS program as well. Thank you for everything you do. Next up, we have a teacher that I met a couple of days ago and is the coolest person alive because they were dissecting cats. Then we have Mr. Montalvo. He is the anatomy and physiology instructor for San Benito High School. He has been instructor for 29 years. He received his bachelor's in science at Pan American University in 1980 and majored in biology and chemistry. What he enjoys most about working with health science students is that they are focused and motivated towards their goals. Thank you. Next, we have Ms. Lozano. Please stand up. Ms. Lozano is the instructor for the Practicum 1 student and is also a licensed registered respiratory therapist, neonatal pediatric specialist in the state of Texas. She attended Incarnate Word College and the University of Texas at Brownsville, where she received a Bachelor's of Applied Technology. She also received her teaching certificate in 2005 and her BLS in 2004. She has worked at several areas, including Valley Baptist, and has 18 years of hospital experience. What she enjoys most about working with HST students is their enthusiasm about learning. And next up, we have Mrs. E. Garcia. Who is the BMA instructor for the Health Science, Technology, and Medical Terminology. She earned a bachelor's degree in business and a master's degree in educational technology. Not only did she obtain these degrees, but she is also a registered nurse. She has worked at several other schools and was a nurse at Port Isabel Detention Center. What she enjoys most about working with the HST students is their ability to stretch their minds. Instructors, thank you so much for believing in each and every one of us. Without your dedication and knowledge, we would not be here standing in front of you waiting to take on the world. Now, please give it up for the man who makes it all possible, our Director of the Career and Technical Education Department, Mr. Hector Rendon.
Thank you, Ms. Garza. Welcome, everyone. Today, we celebrate and recognize the achievements of these fine young individuals as completers of the Health Science Technology Career Cluster. We will also recognize and pin them as medical office assistants, or as medical assistant candidates, or as emergency medical technician candidates tonight. All of these young individuals have been ardently practicing their skills for their chosen career for the past 4 years. They have met and exceeded the expectations of their teachers. Throughout the 4 years, each one of them has been observed and recommended for their grades, excellent behavior, bedside manners, attitude, and commitment to their own established goals. Some of these young individuals aspire to be doctors, surgeons, radiologists, registered nurses, nutritionists, and specialists in clinical lab science, environmental science, or even mental health, etc., etc., etc. Some of these students have also obtained a minimum of 12 college credits through the Health Science Dual Enrollment Program with the University of Texas at Brownsville. So for that, congratulations. I take a quote this evening from the Health Science curriculum by the man, Mr. Jack Canfield, a national success trainer, that states, "If there's one thing I've learned, it's that everyone has dreams. Dreams of creating personal success, dreams of fulfilling a career, dreams of making the world a better place, dream of a better lifestyle, a way out of poverty, and a way to support their family and afford the life they most want." Our program theme tonight is, if you look at the program, it says, "Together we make it work, spread the word." And I can tell you that the togetherness of this group has been tremendous as they gel from year to year throughout the 4 years that they've been working together. We have also used various means to inform our students and the public of our endeavor and successes of the health science program here at San Benito High. The design of establishing a coherent sequence of courses provides the developmental skills for the health science program of study. Our experience has shown, and our teachers have attested to, that a student who has followed the sequence stands a very good chance of meeting their certification or licensure objectives. Students, in the near future, you will become the directors, coordinators, health center office managers, hospital administrators, and such, because the step that you take tonight is just the first step. You have many, many more goals that you will set for yourselves as life goes on. Along with attaining the must-know skills of your area of study, some of you also participated in HOSA. You remember that? Your student organization. As an active member, you were exposed to the various leadership skills. These skills are also referred to as soft skills. The ability to know when to speak during a committee meeting, or how to stay focused on the objectives of the day and not go off on tangents. These experiences will carry you forward into the world of work. Students, do you remember in the 8th grade? Can I take you back just a few years? Do you remember the course career investigations? When you chose to select health science as your plan of study, each of the courses you have taken were set up by design so that the skills taught and learned would provide you a foundation to reach your accomplishments we are recognizing this evening. A famous national trainer by the name of Mr. Harry Wong. How many of you have heard of him? Harry Wong. A few of you in the education field, right? Stated, student achievement at the end of the year is directly related to the instructional activities designed and implemented by the teacher in the first week of school. Can you remember that? And you remember the teachers who set those expectations for you during that first week of school, correct? It is important, and we recognize that the achievement of each one of you has been purposely set. Parents, these students can attest that they have learned discipline, good study habits, and most importantly, real-world application, leading to the infamous question of, when am I ever going to use this? And answered by their perseverance to complete their areas of certification. The students who have completed the established coherent sequence of courses this evening will be receiving a stole and a certificate with the designation of the health science program and the San Benito CISD logo to be worn on graduation night. You will be well decorated, yes? And again, today they receive the most earned recognition. Some are to be pinned as official medical office assistants, recognized by the National Center for Competency Testing, because they were in the first semester of this school year and they tested in December, so we know that they are officially certified. The candidates for certified medical assistants are also recognized by the National Center for Competency Testing, also referred to as NCCT. The emergency medical technician candidates are recognized by the National Registry of Medical Technicians. All candidates have completed their coursework and clinical rotation, whether it is in the ambulance, the emergency room, the hospital, nursing homes, or even the health center offices. Some of our candidates will be testing next Friday, May 31st, and the EMTs will be testing immediately after graduation. Good luck to all of you on those tests. At this time, I would like to share with you just a few statistics in relation to the 2012 Labor Market Information Report and what is expected in the health science technology industry. The greatest likelihood for potential job opportunity in the Rio Grande Valley includes the ambulatory healthcare services, with a gain of 21,908 jobs valley-wide. But in Cameron County alone, the largest change in the past 10 years has been with a gain of 7,161 jobs in this particular area of health science. The estimated openings just for medical assistants is 95 openings with an hourly wage ranging between $8.08 to $11.74. And that's a pretty good salary down here for a young individual, correct? Does anybody know how much minimum wage is? Can anybody tell me? $7.25. This is quite a bit above $7.25, right? And the reason that happens is because you will be a licensed, certified technician, and it is to be recognized. Also in this labor report, we recognize that registered nurses constitute the largest healthcare occupation with 2.6 million job opportunities. About 60% of the registered nurse jobs are in the hospitals. 3 typical educational paths to the registered nurse are a bachelor's degree, an associate degree, and a diploma from an approved nursing program. Advanced practice nurses such as clinical nurse specialists, nurse anesthesists, nurse midwives, and nurse practitioners need a master's degree. Overall, the job opportunities are expected to be excellent. Employment of the registered nurses is expected to grow by 22% between now and 2018. Growth will be driven by the technological advances in patient care, which permit a greater number of health problems to be treated by an increase in emphasis on preventive care. On the EMT, emergency medical technicians, represents the first response of emergency medical systems. An EMT trained at this level is prepared to care for patients at the scene of an accident and while transporting patients by ambulance to the hospital under the direction of most highly trained medical personnel. The EMT Basic has the emergency skills to assess a patient's conditions and manage respiratory, cardiac, and trauma emergencies. A career ladder in this concentration has 5 levels: first responder, EMT Basic, EMT Intermediate, 2 levels, and a paramedic. Employment for EMT and paramedics is expected to grow by 9% through the year 2018. About 45% work as employee of ambulance services, and about 29% work in the local government, and another 20% work in the hospitals. Our medical office assistants perform administrative and clinical tasks to keep offices of physicians, podiatrists, chiropractors, and other health practitioners running smoothly. The duties vary from office to office, but may include answering telephones, greeting patients, updating and filing patients' medical records, filling out insurance forms, handling correspondence, scheduling appointments, arranging for hospital admission and laboratory services, and of course handling billing and bookkeeping. Some may also instruct patients about medication and special diets. Medical office assistant positions are ranked number 3 in the top 25 fastest growing occupations in Texas, a percentage of 54% through the year 2016. The health field in general is expected to allow for many opportunities due to an aging society, increase in longevity due to advances in our medical technology, and of course the public policy that may result in increased access to health care. This group of students has a bright future, wouldn't you say? Thank you for listening. At this time, I would like to turn the podium over to Mr. Aviles. Mr. Aviles.
Thank you, Mr. Rendon. Good evening, buenas tardes. Let me just reiterate what Mr. Rendon said. Having the background in the medical field myself, I worked in the hospital for many years. I can attest the fact that it's a growing field. You will have a lot of opportunities available, especially with the aging population. We're going to have a lot of people retiring. They're going to need care, not only in the hospital, but at nursing homes and even at home. So this field, this medical field is growing. It's going to explode in the next 10 years. And hopefully you'll be ready for that period. Good afternoon. Welcome to this end of course ceremony. Parents, thank you for being here and supporting your children. My name is Mauro Aviles. I'm the coordinator for the Career Technical Education Department here in the district. And I'll be explaining the courses that your children have taken to get to this level, to the certification here in the health science program. Foremost, I need to mention that our career pathway is structured in a way that prepares our students not only to get a high school diploma, but also to get a certification in the health science area, which is what I do. Our certifications include nursing assistant, medical office assistant, medical assisting, and emergency technology. In order for the students to be able to be a part of our career pathway, not only do they require good grades, but they also need to be recommended by our instructors to go on to the next level. Now, the courses that they have to take are the following. In the 9th grade, during the first semester, students take Principles of Health Science, where students learn about the general aspects of the healthcare system in our country. That's what it is. During the second semester, the students take medical terminology, where they learn a unique language to communicate with other healthcare workers. Medical terminology, very important. In the 10th grade, they take health science, where they see an overview of anatomy and physiology and the general aspects of the public healthcare system. In the 11th grade, during the first semester, the students learn all the skills they need to function in a hospital setting. During the second semester in the 11th grade, the students use those skills in clinical rotations at Valley Baptist here in Huntington. In the 12th grade, they have the opportunity to choose 2 different certifications. Depending on their choice, they take their lecture classes at the beginning of the semester and will rotate at different medical offices, nursing homes, or emergency medical service stations to acquire the necessary hours to be here today, sitting down, ready to receive their certification. Finally, as you can see, our career pathway is very complex and very complete to prepare our students to be very successful. Thank you very much.
Hold on. We're at that point now. Parents anxiously await, correct? I will now call the attention to Ms. Annabelle de Leon. And we'll also call Ms. Ellen Garcia. I'll also call to the front Mr. Jaime Ibarra, Mr. Chavez. Other instructors, Mr. Claudio Lozano. They will be assisting in the presentation altogether. And as you can see, and you heard already that the students have had an opportunity to go from grade 9 to grade 12 with Ms. De Leon, as she taught the freshman class and then moved up to the senior level class. So you can see that the end result has been very positive and a great impact on these students. At this time, what I'm going to do then is I'm going to call the individuals alphabetically, and as they come up, they will receive the recognition all at once. So parents, if you'd like to prepare yourself as well, and I'll take it easy, I'll take some time so you can have a chance to come up and take some pictures. But at the same time, at the end, we would like for all the candidates to be available for a snapshot as well. And I would also at this time like to let you know, parents, that the group picture that was taken officially from our class came out yesterday as an insert in the Valley Morning Star under the category of graduate. So if you didn't get a chance to do that, I'm supposed to be able to get a few extra copies and we'll have some of those available. But then also in the San Benito News, it is scheduled to come out on June the 1st. All right, so look for that in the newspaper. All right. So then, are we ready? Let us begin. Our Health Science Technology Graduates Class of 2013 and officially completers of our program sequence, we will begin again alphabetically. Iris Agado, please come. Iris Agado is a certified medical office assistant and is also a candidate for the medical assistant area. Catherine Aguinaga. Catherine is a certified medical office assistant and a candidate for the medical assistant category as well. Gladys Ratia. Gladys is an emergency medical technician candidate. Nelida Barrera. Nelida is a certified medical office assistant and a candidate for the medical assisting.
What's your name?
Guadalupe Catache. Guadalupe is also a certified medical office assistant and a candidate for medical assisting. Candy Cerda. Candy is also a certified medical office assistant and a candidate for medical assisting. Raquel Chávez. Raquel is a certified medical office assistant and a candidate for medical assisting. José Claudio. Jose is a certified medical office assistant and a candidate for medical assisting. Verónica de León. Veronica is a certified medical office assistant and a candidate for medical assisting. José Delgado. Jose is a candidate for the emergency medical technician. Daniel Diaz. Danielle is a candidate for the emergency medical technician category. Esmeralda Flores. Esmeralda is a candidate for the emergency medical technician. Laura Funes. Laura is a certified medical office assistant and a candidate for medical assistant. Crystal Garcia. Crystal Garcia is an emergency medical technician candidate. Anaí Garza. Anaí Garza is a certified medical office assistant and a candidate for medical assisting. Matthew Garza. Matthew is a candidate for the emergency medical technician. Silvia Gonzalez. Silvia is a certified medical office assistant and a candidate for medical assisting. Darian Gonzalez. Darian is a certified medical office assistant and a candidate for medical assisting. Marina is a certified medical office assistant and a candidate for medical assisting. Alexandra Lara. Alexandra is a certified medical office assistant and a candidate for medical assisting. Cassandra Limas. Cassandra is an emergency medical technician candidate. Julissa Marroquin. Julissa is a certified medical office assistant and a candidate for medical assisting. Brenda Mireles. Brittany Ojeda. Brittany is a certified medical office assistant and a candidate for medical assisting. Sabrina Perez. Sabrina is a certified medical office assistant and a candidate for medical assisting. Maria Rivas. Maria Rivas is a candidate for emergency medical technician. Iván Ibarra. Iván is a certified medical office assistant and a candidate for medical assistant. At this time, I'd like to take this opportunity to recognize our high school principal, Mrs. Delia Weaver. Would you please stand? I think that's her idea, and you can see up right above us here, this is her doing as well. The designation of this area for the health science, wing, but that's not going to work. But is the designation of the area to through the work of a task force to design and implement this program here. And all in all, we've had programs dealing with phlebotomy, certified nurse assisting. We're always looking for different areas that will allow us to help our students to be leaving high school, not just with a high school diploma, but with the skill that would allow them and help them to be better off in the long run. And again, as we have mentioned before, this evening you being pinned as a medical office assistant, and in the next couple of weeks that you will be recognized officially as a medical assistant or a emergency medical technician. That is only the beginning, the first step to bigger and better things. And I want to share that with you so that you understand that you have attained your short-term goal, okay? And in the next couple of weeks, you will meet another one of your short-term goals, and that would be, right, Ms. Weaver? A graduation, a diploma, okay? But the event this evening is only a small step in the bigger things that are forthcoming for you. You have many, many opportunities that will be afforded to you because you have taken that challenge for yourself. And also, we expect that you will set your goals once again. Because how many of you studied the Maslow's hierarchy of needs? Does that ring a bell? Yes, remember? You have self-actualized, that's the top of the pyramid. You have self-actualized, but what happens when we self-actualize? When we meet our goal, we simply set new goals, right? And your next new goals would be, again, for some of you, will be a 2-year degree, some of you 4-year degrees, some of you 8, 10 years further down the road, right? All right? And you continue to self-actualize, but through the efforts of setting yourself goal after goal after goal, you will have many, many accomplishments. All right? At this time, thank you very much. You can sit down. I would also like to take this opportunity before we go into the closing that I want to recognize my staff in the back over there. Gloria Hernandez, would you please wave? We also recognize Mr. Paul Hernandez assisting. All right, they have been able to help us to set up and decorate for this evening. Unique decorations that we have here. No se las pueden llevar. At this time then, I will call Iris to the podium.
I would like to thank everyone who came to share this special experience with us. I am speaking for myself and for all my fellow HST classmates when I say thank you to all the parents for their support during these 4 challenging years in the program. Please stand and be recognized. Administration, program coordinators, and bus drivers who made all our clinical rotations possible. Thank you to our principal, Mrs. Delia Weaver, the senior assistant principal, Mr. Henry Sanchez, and the director of the CTE department, Mr. Hector Ramon, the CTE coordinator, Mr. Aviles, and the secretary, Gloria Hernandez. In addition, I would like to give special thanks to each of our HST teachers throughout the years. Of course, we didn't do that, so thank you.